This is the case of 25-year-old Bill McCleary. Bill is a single unemployed male living with his sister and her family. After about 18 months, Bill's sister began to notice some peculiar behaviors and social isolation from Bill, which then she encouraged Bill to seek help. He insisted that he did not need any psychological treatment. Though he was insistent, he did go for psychological help, but he was reluctant to receive therapy. So during his first interview with a therapist, Bill spoke quietly and he hesitated frequently. Throughout the sessions, Bill would constantly blink or shake his head as if to clear his thoughts. Bill began to have guarded sessions with his therapist. He also began to discuss his social contact and his sexual orientation. Bill also explained that he would be distracted by intrusive and repetitive thoughts. Because of these thoughts, he felt compelled to repeat a sequence of self statements he designed to correct the initial thought. Throughout time, Bill noticed people talking behind his back, making him increasingly anxious and suspicious. After about 6 months, Roger, Bill's brother in law, spoke with Bill's therapist about some uneasy things Bill was saying. As to not alert Bill to the things that his brother in law was saying, the therapist would talk to Bill about some other things that she was seeing. Bill came to his therapist and informed her that while he was watching TV, he believed that a group had secretly produced and distributed a documentary about his sexual experiences with men by using hidden cameras and mics during each encounter. Bill also expressed that any money that was made from his documentary would be sent to the Irish Republican Army to buy guns and ammo. So by default, Bill would become responsible for the deaths of dozens. Bill also believed that he would be killed if he found out about the movie. Bill also explained to his therapist that he had heard male voices discussing his sexual behavior and how he should be dealt with. The voices that he heard were people he did not know. Bill suffers from schizophrenia with paranoid delusions.
As we've learned, Bill McCleary's condition is diagnosed as schizophrenia with paranoid delusions, which primarily manifests in his fixed belief that a film has been secretly made about him. This delusion stems from a distorted perception of reality and cognitive dysfunction characteristic of schizophrenia. His delusions are highly personal, self referential, and resistant to any contradictory evidence. This reflects a combination of paranoia, misinterpretation of neutral events, and strong emotional conviction. This conceptualization aligns with the broader understanding of schizophrenia as a disorder involving disrupted thought processes, altered perception, and impaired social and occupational functioning. Bill's case demonstrates how these symptoms can lead to profound distress and disconnection from reality. Moving on to treatment. There are three main modes of treatment within Bill's treatment plan, and it incorporates both pharmacological and psychotherapeutic interventions. Pharmacological treatment. So for Bill's pharmacological treatment, we have antipsychotic medication. In the case study, we learn that Bill is prescribed antipsychotic drugs which target the dopamine system to alleviate psychotic symptoms such as delusions and hallucinations. The goal is to reduce the intensity of his delusions and stabilize his mood and thought processes. Our second mode of treatment is psychotherapy. Within the psychotherapy, we have cognitive behavioral therapy, or CBT, and psychoeducation. For CBT, this mode of therapy focuses on helping Bill identify and challenge the cognitive distortions underlying his delusions. It also aims to develop coping mechanisms for managing symptoms and reducing emotional distress that comes with his beliefs. Psychoeducation. Educating Bill about schizophrenia is crucial for enhancing his insight into the illness and promoting treatment adherence. Number 3, social and supportive interventions. Family involvement. Engaging family members in the treatment process helps create a supportive and safe environment and addresses stigma or misunderstandings about his condition. Social skills training. Reinforcing social and communication skills to improve Bill's reintegration into community and occupational settings. Lastly, we have relapse prevention. This is monitoring and addressing early warning signs of relapse. When this is monitored and addressed, this can ensure continuity in care and this reduces the risk of setbacks. Now, the outcome goals, the primary objectives of the treatment are to reduce psychotic symptoms, improve Bill's quality of life, and facilitate better functioning in daily activities. By combining medication, therapy, and social support, this approach aims to enhance his insight into the illness, reduce distress, and restore a sense of normalcy. Question number 1. How would you describe Bill's delusional belief about the film that had presumably been made about him? What characteristics of his belief system were important beyond the fact that it was not based on evidence that could be shared with other people? Bill's delusional belief. As we have learned throughout this case study, Bill believed that a film had been made about him without his knowledge or his consent. This delusion likely revolved around the idea that his personal life and thoughts were being monitored and used as material for the film. Such beliefs are a hallmark of paranoid delusions, often associated with schizophrenia. He might have interpreted ordinary events or interactions as evidence supporting his belief. Characteristics of his belief system. Personal relevance. Bill's delusion was highly self-referential. He believed that he was the central focus of the film, which reflects the egocentric nature of delusions in schizophrenia. Fixed and rigid. The belief was likely resistant to contradiction or evidence against it. Even when presented with rational explanations, Bill might have dismissed them, seeing them as part of a conspiracy. Grandiosity and paranoia. While the delusion involved paranoia, meaning that he was thinking others were conspiring to film him, it also reflected a sense of significance, that he was important enough to have a film made about him. Lack of shared evidence. The belief could not be corroborated or confirmed by others. It existed in Bill's mind without external evidence that could convince others. Emotional conviction. Bill experienced strong emotions, such as fear, anger, or anxiety, tied to the delusion, which made it feel very real to him. Misinterpretation of reality. Ordinary situations or interactions were likely misinterpreted as evidence supporting the delusions, such as seeing a camera or noticing people look at him. These characteristics highlight the disconnection between Bill's delusional belief and objective reality, as well as the deeply entrenched nature of such beliefs in individuals with schizophrenia. A lot of these characteristics remind me of confirmation bias, which is when our brain is looking for quote unquote evidence to confirm a belief that we already hold to be true. Bill seems to be struggling with a lot of these things and believes that, again, as we have mentioned, that people are filming him and that he is a part of a film that he had no knowledge about. So a lot of these things, as we have mentioned, are key things that point us to signs of having schizophrenia.
Question 2. The earliest symptoms that Bill was developing a psychotic disorder would be daydreaming, talking to himself, or saying things that don't make sense. Meaningful signs prior to the onset of delusions and hallucinations would be the blinking and shaking of his head to return and remain on the topic at hand, or even the sequence of statements to return to his initial thought. I believe that if medication is available, it is effective and it should be prescribed. Research shows that in most schizophrenia patients, it is difficult to implement effective rehabilitation programs without antipsychotic agents. And research also shows that the prompt initiation of drug treatment is vital, especially within 5 years after the first acute episode, as this is the when the most illness related changes in the brain occur. Medication along with rehabilitation will help clients to better manage and maintain their schizophrenia. There are advantages and disadvantages to taking medication. Some advantages will be to reduce and control the symptoms, improve a person's mood, and to decrease their anxiety. And some disadvantages could be weight gain, sleeping problems, or sexual dysfunction.
Question 3 states, given the broad range of symptoms and social deficits that are often associated with schizophrenia, these patients often need a broad array of services and support systems. Other than antipsychotic medication, what are the most important forms of mental health service that would be helpful both to the patients and to their families? It was stated that participating in psychosocial treatment programs would be beneficial for patients, especially the ones that were coming out of treatment and to continue to to be in full recovery. One of the most important programs that they mentioned was family-based programs, especially for those with schizophrenia, and this is to assist with educating families, assist families with their problem-solving skills and communication skills, and of course, to assist with any overcritical family members that the patient may have, since that's usually one of the causes for a relapse in a patient. Also, social skills programs as part of the outpatient services for clients. Some closing thoughts and a brief summary. Bill did struggle with the effects of schizophrenia and was not interested in therapeutic support, but after seeking help, He and his family did benefit from services, and Bill was able to cope and understand his disorder a little better. Of course, schizophrenia was proven to be a little more common than not. It affects 1 to 2% of the population, and it usually affects more men than women. We found that people struggling with the mental disorders such as schizophrenia would benefit from a combination of therapeutic services and potential medication administration, but it's not always guaranteed since not every client or every patient respond or responds to medication. Family and other support systems are also recommended to participate in certain therapeutic services, and this is to better assist the client for a more positive outcome for the client and for them. Of course, it gives them also the support that they may need and the education. Bill was not his disorder. He was able to continue to develop his social skills and continue therapeutic services to better cope with the side effects of schizophrenia.